Okay, so we're now going to move on to our secondary assessment, and the secondary assessment is a detailed check of the body from the head down to the tips of the toes, trying to make a diagnosis of this casualty, trying to work out what's happened to them, and off the back of that we'll work out what treatment we want to deliver. Now this is quite a detailed check, and as I go through this I'm going to be calling out lots of different possible injuries that might have occurred. And at this stage, don't panic if you don't know how to deal with one of the injuries that I'm calling out. All we care about at this stage is that you can identify the injuries, and then later on, if you know how to treat for them, you'll be able to go ahead and do so. If you don't know how to treat for them, then that's absolutely fine. All you're going to do is when you call the emergency services later on, you're going to tell them everything that you found. That's going to help them prioritise maybe your casualty over another call that they've received. It means that when the paramedics arrive, they know what they're walking into and they'll be prepared for it. And it also means if you don't know how to deal with any of the injuries, they might be able to give you some guidance over the phone on how to treat that casualty while you're waiting for the professional services to arrive. So we're going to go through this, and all I care about is that you can identify the different signs and symptoms that I'm calling out. Don't worry if you don't know how to treat for them straight away. Now you'll notice that I've put some gloves on. This is because this is quite a sort of touchy-feely check. I'm going to be working my way all the way down the body. I'm likely to come into contact with some bodily fluids, so we recommend, if possible, you put on gloves just to protect yourself from that sort of cross-contamination risk. And as you go throughout this check, it's worth just glancing at your gloves every 10 or 20 seconds just to see if you've got any signs of blood or bodily fluids, because you might not see blood on the body, but if you just look at your hands, you might see that you've actually come across some blood at some point, and then you can obviously go back and just check that area just to see if you can find any signs of injuries. So to do this, I'm going to start off at the head, and I'm going to start off by feeling across the scalp of the head, and I'm just feeling for any lumps, bumps, sort of bruising or any damage across the scalp of the head. Is there any blood or anything like that? Next up, I'm going to look into the ears, and I'm looking for a couple of things around the ears. I'm looking for bruising behind the ears. That might be a sign of a serious head injury, such as a concussion. I'm also looking into the ear. A couple of things that might occur here. You could get some blood leaking out of the ear. Blood is usually just some damage to the ear canal. You can also get a clear watery fluid, and sometimes this watery fluid is mixed in with a sort of yellow discharge. And if you get that, it can be a sign of a serious head injury, such as a skull fracture. So we're just looking at any fluids coming out of the ears there. Again, don't worry if you don't know how to treat for these injuries. All we care about at this stage is you can identify these problems. Once you've done that, we're now going to move on to sort of the center of the face. I'm just looking down the face to see if there's any clear signs of damage. Once I've done that, I'm just going to open up the eyes. As I open up those eyes, I'm looking for a couple of things. Number one, I'm checking to see if the eyes react to the light. So when you open someone's eye, light should hit it and the center of the eye should shrink in size. If one or both of those eyes don't react to the light, then it could be the person's got a head injury, such as a concussion once again. I'm also having a general look at the size of the pupils in the eye. If you have a pinpoint pupil, it could be that the person's taken a drug, such as a narcotic like heroin. If you've got a very big dilated pupil, it could mean that you've drunk some alcohol, or alternatively you might have taken a drug, once again, a stimulant like ecstasy or something like that. So the eyes can give you an awful lot of information. It's worth having a detailed look at those. Once I've done that, I'm just going to look up the nose. I'm looking to see if I can see any blood leaking out of the nose. It could just be a nosebleed or some damage to the nose canal. I'm also looking to see if I get a clear watery fluid leaking out once again. So similarly to the liquid coming out of the ears, you can get this watery fluid leaking out of the nose once again, and that's a sign of a serious head injury such as a skull fracture. Next up, I'm just going to open up that mouth. I'm having a detailed look around that mouth. Are there any dental injuries? Is there any flesh damage or anything blocking the airway? Just having a general look around that mouth for signs of damage. I'm now going to feel across the shoulders and the collarbones, feeling them at the same time so I can compare them to each other. And I'm looking for a few signs of injuries here. First of all, you can get a fracture in your shoulder where this bone can sort of pop up. It might break the skin and you actually have a bone sticking out of the skin, or it might just pop up and you've got a lump on the shoulder. So I'm looking out for anything like that. Second, you might find that the shoulder is very loose and floppy, maybe it moves unnaturally. There could be a dislocation or a fracture once again in that region. Third thing is the shoulder just very swollen and firm? There could be some form of muscle tear or something in that shoulder as well. So looking for any abnormalities again across the shoulders. Again, don't panic if you don't know how to deal with these injuries. We're just trying to identify them at this stage. Once I've done that, I'm going to work my way down the arms. I'm looking for lumps, bumps, bruising and swelling. When I get down to the wrist, it's worth just having a detailed look at the wrist, because lots of people have medical bracelets or other medical information on their wrist. These are a few examples of some medical bracelets. We'll put an image up on the screen so it's a bit clearer for you. But on each of these, they have a little charm or a little message on which says medical alert, and then it might say something like type 1 diabetes or penicillin allergy, anaphylaxis. So have a detailed look at anything you find on the wrist. There could be some medical information there. Equally, if you have an electronic watch, I've got an Apple Watch here, sometimes you can have a medical alert that pops up on the home screen of that electronic watch. So just tap it to see if you get any medical information appearing. Alternatively, I found people in the past that have tattoos, and in a pattern of tattoos on their arm, they sometimes have a little snake and it says medical SOS, and it might have details of their condition. So have a detailed look on the wrist for any of that information. Once you've done that, I'm going to move on to the hands. Have a look in between the fingers for any needle marks. It's a common place to inject yourself with drugs. And then what you can do is just pinch the thumb just for a quick circulation check. If you pinch your nail, you should find that it goes white, and then as you release it should flash back with colour. Now obviously I'm wearing gloves at the moment, so that doesn't work. Equally, the casualty might be wearing nail varnish or something like that, in which case it doesn't work. So a good alternative is just press 2 fingers down on the forehead and release. You should notice that it goes white and then it rebounds with colour nice and quickly. It's just a quick circulation check. Once we've done that, we'll move on to the other arm. Again, lumps, bumps, bruising and swelling, checking the wrist for any medical information, looking across that hand for signs of damage, in between the fingers for needle marks, pinch that thumb for circulation. Once I've done that, I'm going to start working my way down the centre of the body. Using the back of my hand here, I'm just going to feel down the sternum. Again, just feeling for any abnormalities. Is there anything that feels abnormal there? Any fractures, any swelling? Go around the belly as well. Again, any swelling or clear signs of damage. When I get to the centre of the body, a few things I want to check here. First of all, this part of the body is usually where you have pockets. So I'm going to look in the pockets here on the trousers if I'm happy and think it's safe to put my hands in. And I'm just looking for some medical information or some personal information. So you might find some medication in the pockets which might indicate a medical condition that this person has. Some people have a medical alert card in their wallet which might have details of a medical condition. If you've got a phone, again, you might get a medical alert appearing on the home screen of the phone, so have a look at that. Alternatively, if you can just get someone's wallet and you get their driving license, that can have your name, date of birth, address. If I can give that information to the crew on the phone when I call them, they might be able to pull up some of their medical history, and that might give them some information about what might possibly be wrong with this individual. So any of that information you can find in the pockets is really, really useful. Alternatively, if there's handbags or rucksacks, I might have a sift through that as well. Remember, around our casualty communication, as I'm going through this check, I should be speaking out loud about what I'm doing, particularly if you're searching through pockets. Speak out loud so people walking past know you're not trying to mug this individual and you're just looking for medication. Once I've done that, I'm going to work my way down the legs, just feeling for any abnormalities once again, lumps, bumps, bruising or swelling. Have a look at the ankles to see if they look swollen. Are there any is there any sort of blood leaking out of the shoe as well, which might indicate some damage to the foot? That now completes my secondary assessment. I've checked from the head down to the tips of the toes, trying to pick up on any signs of injuries, trying to pick up on any personal or medical information as well. Once you've done this, if you find an injury that you know how to treat for, I can now go ahead and do so. If not, I'm going to put this person into the recovery position, as we'll be teaching next, and then you're going to call the emergency services, and when you call the emergency services, you can tell them everything that you found. And if you have an injury that you don't know how to treat for, they might be able to give you some guidance over the phone on how to treat that person in front of you. I'm going to repeat the whole sequence from the primary survey into the secondary assessment all the way through. And then once again, I'd recommend you stop, just have a go doing this yourself at home, and then we'll move on to the next step. So here we go. From the top, I come in, I'm checking for danger. There's no danger. Hello, can you hear me? Can you hear me? Can you open your eyes? There's no response. Can I have some help, please? I'm going to open the airway. I'm just looking around the airway to check it all looks clear. I'm now going to check the breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. In this situation, the person is breathing normally. I'm going to put my gloves on. I'm going to start my secondary assessment. I'm feeling across the head for any lumps, bumps, bruising or swelling. I'm looking at the ears. I'm looking for any bruising behind the ears or any bodily fluids such as blood or a clear watery fluid leaking out of the ear, which could indicate a skull fracture. I'm going to look across the face for any clear signs of damage. I'm opening up those eyes just to check they're reacting to the light and the pupils are normal size. I'm then looking up the nose to see if there's any bodily fluids leaking out of the nose once again, blood or a clear watery fluid. Opening up that mouth, having a look around at the flesh in the mouth and also the teeth to look for any signs of a dental injury. And then feeling across the shoulders and the collarbones, feeling for any abnormality. Is it loose and floppy? Is there a bone sticking out of the shoulder? Is it very swollen and firm? Again, if you don't know how to deal with these injuries, don't panic, just try to pick up on these key signs and symptoms at the moment. I then feel across the arms, lumps, bumps, bruising and swelling, looking at the wrist for any medical information such as medical bracelets, check in between the fingers for needle marks, pinch that thumb for circulation. I'll go down the other arm as well. Medical bracelets, check those fingers and the hands. Now I'm going to use the back of the hand down the sternum, feeling for any abnormality. I'll go around the tummy as well, it all feels good. When I get to the centre of the body, it's a useful point to check pockets, rucksacks, any of those things for personal or medical information. Again, only put your hands in if you feel safe. If you think the person's been taking drugs and they've got needles on them, you might not feel comfortable putting your hands into their pocket in case you jab yourself with a needle. So just take a bit of care there. I then work the way down the legs, lumps, bumps, bruising and swelling, looking at the ankles to see if they're swollen or any blood leaking out of the shoe. If I find any injuries I know how to deal with, I can go ahead and treat for them. If I don't know how to treat for any of the injuries, that's absolutely fine. I'm going to move on to my next step, which is the recovery position, which we'll be teaching next. I'm then going to call for an ambulance and I'm going to pass on all of the information that I found. That completes our secondary assessment. Stop here, have a practice at home on your favourite teddy bear on the floor, and then we'll move on to the next step, which is the recovery position.